কমলদা,
Good afternoon, Dr. Pal. We are not yet ready yet. We will be ready by 3.
ম্যাম জাস্ট একটু চেকিং করার জন্য অনলাইনে এসেছিলাম যে সবকিছু ঠিকঠাক আসছে কিনা, সাউন্ড ঠিক আছে।
আচ্ছা, ঠিক আছে। আপনি পরে আবার যদি 3টের সময় জয়েন করেন, ঠিক আছে তাহলে।
ম্যাম এমনি সাউন্ড ঠিক আছে?
হ্যাঁ, সাউন্ড ঠিক আছে।
এখন স্যার বাজে 2:40, এখন 2 মিনিট দিয়েছে।
পাঠাচ্ছি মোনালিসা, 2 মিনিট দাঁড়াও। আচ্ছা, ঠিক আছে। হ্যাঁ, হ্যালো। হ্যাঁ, পাঠিয়েছেন? আচ্ছা, ঠিক আছে, ঠিক আছে। আচ্ছা, আমারটার থেকে তো প্রেজেন্ট করা যাচ্ছে না। আপনারটাতে করা যাবে ব্যানারটা? আপনি করে আচ্ছা।
Welcome, Dr. Partha to this webinar. I think that it will be a very interesting webinar.
So,
Good afternoon, all of you. Good afternoon, Honorable Speaker Dr. Partha Honorable Director Sir Dr. Piyush Pal Roy, respected Register Madam Mrs. Ruma Mitro, fellow faculty members and my dear students. I am pleased to welcome you to the webinar on vaccination drive on COVID-19, pros and cons. The NSS Society of BCREC wishes to instill in its students responsibility and dedicated social leaders. I hope that through this webinar, they will be able to take informed decisions. I now request our Director Sir to please say a few words at the start of the event. Sir, please say a few words. I once again request our Director Sir to please say a few words at the start of the event.
Oh, sorry. Because I welcome you all in this very important webinar. And our very distinguished speaker today is Dr. Partha Pal, who is the Chief Medical Superintendent. And he holds a MBBS degree and MPhil degree from CMC Vellore and its Pilani. And the topic that he has already chosen, it is a very pertinent topic at this juncture. Because the vaccination drive is very pertinent at this point of time. The meaning of pros and cons, you may be knowing that why he has used this pros and cons. It is something that is advantages and disadvantages. While you consider carefully that
sound is not clear.
so before making any sensible decision, these are the advantages and disadvantages that he wanted to speak actually. So it is a very pertinent as well as very fitting word that we have used. Thank you very much, sir, that you have chosen this particular word. I think that you will be very much actually getting the knowledge on this COVID-19 because we are a part of making this one. Those who are we are so I think that the topic, I think that this webinar is a very useful webinar for all of us. I would request all the participants, please put your mobile, put your sound system in use. It will not keep all others. Thank you very much and welcome you, sir.
So I should start now?
Dr. Pal, Professor Roy will give a brief introduction and then I'll request you to start. Professor Roy, please introduce our speaker. Professor Roy, you're inaudible. Please just
unmute yourself. Okay. On behalf of BCREC as well as NSS team, we are really pleased, sir, and thank you to welcome you on this renowned one of this such a webinar where we introduce a topic which is vaccination drive on COVID-19, and we have with us Dr. Partha, who is the Chief Medical Superintendent of Mission Hospital, Durgapur. In a brief, we can say that he started his job in a form of a countryside hospital to a leading corporate hospital in Eastern India. And he worked as a physician in backward tribal areas also, then shifted as an emergency physician in KMC Vellore and family medicine physician in Panditari Institute of Medical Science also. He developed and launched the compassionate of the human touch for the sick, rich, and unrich, learned the art of morality and effective humanity. So we are very much pleased, sir, to welcome you for this such a event, and we are thankful that this topic will be introduced by you. Our dear students will definitely will be inspired and helpful by getting your words. So now it's over to you, sir. We will start our session. Thank you.
I thank I thank you all. Thank you, Director Sir, Madam Srini Ghosh and Priyanka Roy and all others present today, and my dear students. Let me tell my stand very clear that I am not a COVID specialist. I am not a COVID specialist because this disease has come just 1 year back, and a lot of researches and clinical trials are on the process. So no one can claim that he is specialized in this disease because lot of trials, lot of studies are still in the process, and whatever we have derived, whatever the literature review says, because all of you are engineering students and pharmacy students. So, and it is a topic on the, I am addressing the engineering college students, but so you understand that everything is evidence based, and so the evidences are coming on now. So now let me start with this. I will give just a brief introduction of this COVID-19. It is a coronavirus disease, and this infection is caused by SARS-CoV-2. Now what happened, this COVID virus, it was previously just a virus which caused a flu-like syndrome, just a throat pain and just flu-like mild fever and all. Subsequently, there were mutagenic strains which evolved, and there was an evolution, and that led to the SARS, the disease SARS and the MERS. And subsequently, in coming years, it has been mutated. The mutations went on, and that was a SARS-CoV-2 virus, which was which led a catastrophic turn. And as you all know, that in March 2020, WHO declared COVID-19 as a pandemic which ravaged the healthcare, economic and social progress and system globally. So this was thing, and we had been fighting with this COVID disease for last 1 year, from 2020, and we have come to 2021. Lot of patients we have treated in this hospital. We have made isolation wards, isolation ICUs, OPDs. We have also introduced the COVID tests, then the drugs, all those things. And subsequently, when we first started with this disease, we had very little idea and knowledge. Subsequently, the literature reviews, the scientific progress told us, and we went on the track. Now the countries like India have taken strong measure to contain the virus. That means to contain the spread, and the vaccine will provide solution by enhancing the immunity and containing the spread. Now what is the role of this vaccine? This vaccine will contain the spread and will decrease the infection. Now how does a vaccine works? Vaccines will aim to expose the body to the antigens, just like antigens, and provoke the immune response, which can block this virus out. It will decrease the virulence of the virus, or it will kill the virus. Also, the role of vaccine is just like an antigen in the body. So what will happen if that vaccine is given to you? Then there will be an antigenic response, so antibody will develop that will block the virus or kill the virus. This is the fundamental concept of a vaccine. Now my point is vaccines, is it mandatory to take the vaccines? No, it is not, it is voluntary. In the government and as per the WHO criteria, it is not mandatory, but it is valid, it is voluntary. But the medical experts suggest, I will also suggest that it is advisable to take the vaccine. Now, how many doses? So it is advisable to take the vaccines. One. Number two, we require a 2-dose schedule. There will be 2 doses, 2-dose schedule, 3 to 4 weeks apart, and the route is intramuscular route. Now the next question is, once the people is affected with the COVID, suppose one of us is affected with the COVID virus, and should we take the vaccine or not is again a question which will come. Should we take the vaccine or not? Yes, we should take the vaccine because this vaccine will provide a strong immune response. So if you had COVID virus, so in your body there will be antibodies. These antibodies will be at a certain level, but if you take this vaccine, it will increase the immunogenic response. Now, are these vaccines safe? Is a question which comes to our mind. Yes, they are safe because they are cleared by the drug regulator of the country. Just like polio, measles, and all these vaccines have a very stringent regulatory practices in the country. And I can assure you on this that we have been successful in so many vaccinations like polio, measles, and all these things. And our government has a very strong regulatory body for monitoring. So it is a safe vaccine. But one more suggestion, that entire schedule, that these 2 doses should be covered by the same type of vaccine. Suppose we are at the present, we have 2 types of vaccines which are being given. One is the Covishield, other is the Covaxin. Suppose you have been given Covaxin as the first dose, second dose should also be Covaxin. These are points to be noted. Suppose you have been given Covishield, then you should take Covishield as the second dose. Then now comes high risk category patients, like a patient having type 2 diabetes, chronic kidney disease, or or cancer patients. Should they take the vaccine? Yes, they should take because the high risk category have a low immunity. So they should take the vaccine. There is no contraindication for the vaccines. Vaccines are contraindicated for pregnancy and lactating mothers. Vaccine is contraindicated for pregnancy and lactating mothers. Recently, some research, some review articles which I reviewed, there was that suppose you had a COVID, you have been infected with COVID virus, and you have been admitted in the hospital, and you have been given some convalescent plasma or some monoclonal antibodies, then this vaccine should be deferred for a period of around 4 to 8 weeks. That is one evidence-based literature which has come recently. That means suppose you have been treated with convalescent plasma, which was also one of the mode of treatment previously, then at the present moment you should defer your taking the vaccine for at least 4 to 8 weeks from the recovery. Now, what are the common side effects with this vaccine? Any vaccine if you take, there are common side effects like flu-like syndrome. You will have mild fever, mild body ache. This is what this. There have been no such significant reports of complications for this vaccine. And what happened? We have got some of this news that after the intervention, after administration of these vaccines, there were some deaths. But it was by the committee, by the inspection committee, by the regulatory committee, later it was clear that it was some comorbid factors for which the death has occurred. For example, a person has taken the vaccine and in the night he had some cardiac ailment or he was already a patient of a coronary artery disease. After taking the vaccine, there was a coincidentally, suppose he had an MI or he had a stroke, it cannot be held responsible that vaccine has caused the stroke or caused the MI. Now, what is the length of time that vaccine will give protective immunity? It is again a question. Literature review says it is 4 months. It is 4 months. It is 4 months. The protective immunity will be there for a period of 4 months. Now, is there any evidence which says that COVID-19 vaccine can completely stop people from being infected? There is no such literature review which says that it will completely stop. Suppose you have taken the vaccines and you are totally free, you take 2 doses of vaccines and move about and get. There is no such evidence which says that you are completely immune to take it. But it has implications to promote the herd immunity. So this is all about the vaccines. Now, what are the types of immunity? So you should understand that we generally have in the body 2 types of immunity. One is the effective immunity. Other is the sterilizing immunity. Now, what is the role of effective immunity and what is the role of sterilizing immunity? The effective immunity, what happens that it prevents the pathogen from causing the serious disease. That means it decreases the virulence of the virus. And what is the sterilizing immunity? The sterilizing immunity is that it stops the total infection. Even asymptomatic cases with COVID will not occur. But what is the type of immunity these vaccines will give is still now it has not come out. It is in a phase of a trial. Now, what are the types of vaccines? Because now a lot of questions to come to us. Which vaccine to take? So, I will say that all the types of vaccines are tested on a trial basis. The clinical trials are going on. Now, let me tell you what are the types of vaccines which occurs. Now, one is known as the virus vaccine. For any vaccine, types of vaccines are, one is called the virus vaccine. And what happens? It uses the virus in a weakened and inactivated form. That is the virus vaccine. It uses the virus. The same mechanism by which the polio virus and the measles have been formulated. That is called the virus vaccine. Now, which is the category of virus vaccine? Here, the Covaxin is a virus vaccine. It is a dead virus or an inactivated virus which is injected in the body and it gets an antibody. That is the Covaxin. And there is other types of vaccines known as the viral vector vaccines. What happens? In a viral vector vaccines, what happens? Virus such as adenovirus, or other forms of virus, is genetically engineered to produce the coronavirus protein in the body. But the virus is in the weakened form. Means some other virus, adenovirus, is engineered in such a way that it produces the coronavirus protein. And the virus is weakened and it cannot cause the disease. This is the second form. Viral vector vaccine is the Covishield. So the difference between the 2 vaccines, one is called the Covaxin, other is called the Covishield. The companies are giving us. The Covaxin is the dead virus which is being introduced to the body in an inactivated form, like the polio and the measles, and the viral vector vaccines is the Covishield. There are other vaccines, types of vaccines, like the nucleic acid vaccines and the protein-based vaccines. In the nucleic acid vaccines, DNA or RNA is inserted into the human cells and they can produce the copies of the proteins. And the other one is the protein-based vaccine, that is the virus protein fragments are injected into the body. So these are the types of vaccines, and the vaccines which are available in India at present are the two types: the virus vaccine, the Covaxin; the other one, the viral vector vaccine, that is the Covishield. Now, other questions which arises is the booster vaccine. Whether we should go for a booster dose or not. Now, we should understand the body has two types of immunogenic response. One is called the uh, the plasma B cell response, other is called the T cell response. Now, when you have the first dose, you get a plasma B cell response, and at that time, you have an antibody level developed. But subsequently, what happens? This level decreases. So what we do is that we go for the next dose, and that is the T cell response, and it will specifically tailor to identify the particular pathogen and kill it. So my suggestion is two doses are really required in this sort of vaccines which are being given. And again, I would like to say that COVID-19 vaccine produce what type of immunity, whether it is a human immunity or whether what type of immunity it produces, it is too new, but it has the ability to prevent the transmission. One thing is too new, the subject is too new, but it has the ability to prevent the transmission. Now you might also be getting a lot of questions about the trials. What does these trials mean? Like phase 1, phase 2 and phase 3 trials. Actually, these are clinical trials. Now, what happened in a phase 1 trial? In a phase 1 trial, what happens? It will test the vaccine safety. Here, the 8 to 10 participants, a few participants will be there, and it is tested, and it is the safety. The phase 1 trial deals with the vaccine safety. Now, the second trial, what we call the phase 2 trial, it consists of 50 to 100 patients, or 50 to 100 people will be, participants will be there, and it will test the production of the antibody virus against the virus, whether after giving this vaccine, antibodies are being formed against the virus, that is the phase 2. So all these vaccines have covered this phase 1 and phase 2. But now it is on the phase 3 trial. What is the phase 3 trial? The phase 3 trial, it consists of a sample size of 30,000 to 50,000, and whether this antibodies causes actual protection, whether actual protection is offered by the vaccines or not. This is the phase 3 trials. So these two, all of them are in the phase 3 trial phase. So I will like to say that the vaccines are effective in producing the immunity. Number one, if you take vaccines, it is not that you will not have this COVID virus infection, but so what it will do, it will prevent the spread, it will create herd immunity. Means, suppose if I take this vaccine, I have an antibody developed, and what will happen is that when I sneeze or cough, it can go to some other people, so they also will get the antigenic response in a small dose, and they will also develop antibodies. So the herd immunity will develop, and it will prevent the transmission. Number one. Number two, regarding the safety of the vaccine, yes, it is safe because any vaccines which have been passed are passed by the regulatory committee of the country, and we are very successful in this vaccine because we have got the polio eradication also. So the vaccines are very safe. You should take 2 doses. It is not that 1 dose will be enough. The 2 doses will, because then again there is a concept of 2 types of immunity. One is called as T cells immunity and the B cell immunity. So collectively it will be better. And what are the reactions after taking these vaccines? There are no reactions till now noted. No such deaths have been reported. It is whatever deaths which have been reported, it was a chance. It was a by chance. It was a coincidence. As I explained, suppose a patient will have MI and he gets a vaccine, and in the night he gets an MI. We cannot blame the vaccines for this. There are contraindications for taking the vaccines. Pregnancy and lactating mothers should not take the vaccine, and children are not being given the vaccines. And So this is from my side. Any questions are always welcome. I will try to answer. If at all, I will be happy to do so.
Sir, if you permit me, I have some, not the questions, I have some queries actually. Uh, I have few queries, but one query that you told that it will protect if we take the vaccine, it will protect us for 4 months. Is it so?
Yes, there are some literature. The literature reviews by this uh, Minister of Health and Family Welfare Government of India also. We have got this that this protective antibodies they will be there up to a period of 4 to 5 months.
4 to 5 months.
After that, the level will come down.
Then after this 4 to 5 months, what will happen if we expose to some COVID-19 patient? Then will it get to take it, or the antibody has been made so nothing will happen to us?
No, this is not that key. For example, you take influenza vaccine.
Okay.
You have to take every year, right?
Okay.
So it is the same concept that every year you have to take influenza vaccines.
Okay. Okay.
We are giving two vaccines to old people, like one is the pneumococcal vaccine, other is the influenza vaccine. Influenza vaccines we get every year, and this pneumococcal vaccine we give every 5 years.
Okay.
So the concept is same. For the influenza, like the influenza vaccine, this vaccine has to be given every year. But till now, we have not got any scientific literature review.
Okay. Now, so far the two vaccines are concerned. One is Covaxin, another one is Covishield.
Yes.
Which one you preferred actually? Because
Actually, this is a very debatable topic. Debatable topic because it is cleared by the government of. But I have told you the concept. The concept is one is a dead virus. Itself, the COVID virus in an inactivated form is introduced in the body, giving the antibodies. That is number one. But in this case, what happens? Some other virus is genetically engineered with a low virulence into the body, with the protein and the antibodies developed. Now, it is very difficult for me to comment because we do not have any. This needs a review on the phase trials will only tell us.
okay. My third one is the preservation. That is that preservation in a certain temperature, -60 or -73, something like that. If we do not preserve properly, then what will happen? Will it be safe for to take that vaccine if it is not
So
preserved?
the preservation is from +2 to +8.
Plus?
+2 to +8.
Oh, +2 to +8. But
8.
somebody was telling that
We,
it
are
is
not, we do not keep in the deep freezer. We have to keep in the topmost compartment in the ILR or in the fridge side.
okay. +2 to +8
+8 degrees centigrade. Yeah.
degrees Celsius. Okay. Then, my last question that because you see that in general procedure, because the usual vaccines, those our specifically that company, they have also developed many of the practices. It requires a time period actually for this field trial, and they have squeezed this because the computer simulations or something like that. They have squeezed the clinical trials time. You feel that due to the squeezing of time, the quality of the vaccine will remain same or nothing will happen? I just want to get certain opinions about it because you see that the government of India is telling that nothing will happen because we have taken all the precautions for that. I just want as a
See, I have answered in this thing that when we go for this clinical trial, there is phase 1, phase 2, and phase 3. Now, phase 1 itself, it tells about that it will not produce any complications.
exactly.
If all this have gone through this because the phase 1 is about the vaccine safety.
Okay.
Now the phase 2 will tell you how much antibodies are developed with this vaccine.
Okay.
What is the level of antibody which has been developed with this vaccine?
Okay.
And phase 3 trial will tell you whether these antibodies are working against the virus or not.
Okay.
So phase 1 and phase 2 is cleared for all this. Without phase 1 and phase 2, it cannot come to the market.
Okay. Okay. Sir, the last submission, if you permit me, my last submission is that there is a general opinion in the market that people are telling that most of the persons are becoming herd immune now. So there is no need of taking extra vaccine for that. There is a general talk.
No,
Is it so?
no. Now, at the present thing, also, we cannot say that everybody has developed immunity or this. This is a wrong concept. Now, also, if we take vaccines, also, we have to maintain the social distancing and all other safety measures need to be taken because it is a pandemic, and when the pandemic free has to be declared in a WHO level or in a World Health Organization level, we are not free of this. I would like to say my things is that previously when we used to send sample size of around 100 patients, we used to get a positive around 30. But recently, for last I can say around 7 to 10 days back, also we got one. But
Mm.
now for last 10 days we are not getting any. Though we are sending for every almost all the patients going for the OT, all the patients having intervention procedures, we are sending for the COVID test, we are not getting much positivity. The prevalence rate has decreased. The prevalence rate
Okay.
has decreased. But now, how far it will be and what will be, no one can comment on it till now, till date.
Okay. Sir, what about the diabetic patient? Because my wife is also diabetic for the last 20 years.
Diabetic patients are immunocompromised patients. They should take the vaccine.
They should take. No, nothing happened. Nothing
No
happened.
complication. I myself with a diabetic, I have taken the vaccine. I have taken
Okay.
this Covishield, and actually, many of us we have taken the Covishield vaccine because it was available. We didn't have any choice for that. We had taken Covishield.
Okay.
But I
So
also know that
diabetic patient, the patient can take the vaccine.
they
No,
should take. They should take. Diabetic patient, chronic kidney disease patient, cancer patients, they have a decreased immunity. So a
okay.
person having a decreased immunity should take this vaccine because this will have an antibody developed against those virus. So the infection virulence will be less or there will not be any infection. That is also not very clear till date. But the vaccine can do two things. Either it will decrease the virulence of the virus which infects your body, number one, or it will stop the virus from infecting you.
Okay. Thank you very much, sir. I could get many of the answers, unknown answers. But thank you very much. I think that many others will have little
Yeah.
bit questions that they can
Yes.
also
Yes,
they
sir.
want.
Sir, I have one question. Sir.
Tell me, sir.
Sir, is it necessary to give doses to the children, our children?
No,
To
the
say,
children are no children are from high.
এখনো হয়নি আচ্ছা আচ্ছা
We are not giving
আচ্ছা
those.
ওকে
Children's, pregnant mothers, lactating mothers. And suppose a person is having some serious disease. Suppose the person is having a viral pneumonia and is being admitted to the hospital, some acute conditions. In some acute clinical conditions, we are not advocating to give the vaccine. Acute clinical condition means the patient is having high fever, cough and cold, getting admitted in the hospital, we don't give vaccine to them. It is contraindication. And one more contraindication I told previously, COVID treated patient, if the patient has been treated by this convalescent plasma, or then you should withhold this vaccine for a period of 4 to 6 weeks, or 4 to 8 weeks, something like that.
থ্যাংক ইউ
Sir, I have a question. Sir, I have a question.
Certainly.
That every 4 months, that vaccine is effective only for 4 months. So
Yes.
you need to take the vaccine every 4 months then.
Actually, what happened, the main idea of this vaccine is to prevent the spread of the disease.
Okay.
So once you take the vaccine, there will be herd immunity developed for these 4 months, and there will not be any spread. So there will be very less chance of you getting infected with the virus.
Okay, sir. Thank you.
Sir, some of our students have some general queries to you.
Yes.
Just let me introduce in front of you. Someone from Suranjan Haldar has asked you that can we stop wearing mask after vaccine?
No, we have to wear the mask, social distancing. All things need to be followed till date because we are not yet free
Principal
from
said that
this.
what happened after 4 months? What we should do? What happened after this 4 months? Then what will be our side precaution or whatever that?
The precautions need to be taken till date and need to be continued. and gradually we are in a decreasing trend. The prevalence rate has decreased, and the time will come, perhaps within 4 to 6 months, if we look optimistically, there may not be there will not be any COVID patients more. For
And
example, the SARS. So, for example, if you tell the SARS was also like an sporadic cases came of SARS, and ultimately we are not getting any such cases of SARS.
exactly. Sir, parallelly, I have a personal question that from the general concept that we have Covishield, we have Covaxin.
Yes.
Currently, we have heard from media or the news portals that Johnson and Johnson has already introduced a vaccine, which is a one-dose system, which is of low cost. So, how the general people will react with this kind of new introductions of vaccines? We should opt for this kind of thing, which will be easily available for us, or we should wait for any recommendation or something like that.
No, no, there is no such recommendations. One thing, ignore the questions. There is no such recommendations because all these vaccines which are released are on a trial basis. But they have already cleared the trials, clinical trials, because the government of India, when they have released the vaccine, they have cleared the trials and the safety and efficacy is to a reasonable extent. There is safety and efficacy. I have already explained to you about the types of vaccines. One is the viral vaccine, other is the viral vector vaccine. Now the Covaxin, what happened? It is a dead virus in an inactivated form. And so this virus will be introduced to the body and it will produce the antibodies. Other vaccine is the Covishield, in which some other virus, adenovirus, is engineered, and there was some protein which is developed, and this protein will develop the antibodies. Now, how far effective will these antibodies? How far effective will this? That is too early to comment now.
Sir,
I will not personally suggest any recommendation because there is no scientific base for passing any recommendation. People will say that somebody will say Covaxin is better, somebody says Covishield is better, no reaction, but these are all hearsay. Whenever we have to tell or comment anything, it had to be validated by some literature review and some scientific evidence.
okay. Sir, Ankit Roy has asked that if someone has asthma, then should he or she take the vaccine?
Yes, he can take the vaccine. There is no contraindication for asthma.
Okay. And sir, after taking this again, if you repeat these things, because so many students have asked that after taking the vaccine, what are the basic precautions we should take in
No
general?
basic precautions are required. Only the precautions for which the COVID precautions what had been recommended and what we had been practicing for last 1 year need to be followed. We are not free that we are we. The main thing what we want to say is that it is not we are not free that we roam about. We don't maintain social distancing and all. All these things and norms need to be maintained. We have to have the hand hygiene. We have to maintain the social distance. We have to follow the respiratory etiquettes, like putting a mask when a person sneezes. You have to put this. These are respiratory etiquettes which need to be followed till date. Any other questions?
Yes, sir, we are just
Well,
checking.
sir, when we can expect in Durgapur that everybody will get the vaccine, specifically the 60 years age? Because I registered, but it was not working functionally.
Yes,
When
sir,
it
same thing for my mother
Actually,
also.
the idea is that first of all the healthcare and frontline workers will be getting the vaccines. That is number one. Number two, then greater than 50 years or less than 50 years with comorbid factors. So now, Government of India recently have passed. So recently, it will be app based, and I think within another 2 3 days it will be coming up, so that you can register yourself. There will be site for us. We will be having our hospital have the site also. So you put the hospital site and you register yourself, and perhaps
actually, day before yesterday I registered, but it was not properly functioning. Yeah, I mission hospital actually. But
okay,
it was
but I think the whole system in this district is still foolproof is not being done. It will take 1 day time. Perhaps today or tomorrow it will be finalized
okay.
because it is totally controlled by the district.
District authority. Okay. Thank you very much, sir.
Sir, again, another query is for you.
Uh,
Some Someone is asking that what are the disease actually, if you mention specifically that for which we should not take the vaccine in general. If there
For
is some specific disease for which we should not go for the vaccination, if you mention, or is there anything some
what I said is that if there is if a person is suffering from some acute episode of a disease, for example, a patient is having severe respiratory distress with fever and all, with pneumonia, being admitted to the hospital. Any acute emergency disease or any acute thing, we should not take the vaccines. We should defer it.
Okay.
Rest all of the diseases, you should take the vaccines. Suppose high risk persons like diabetic, hypertension, all these persons, all this should take the vaccines.
Okay. Okay, sir. I think these all are the queries. We have our.
I got one question from Kamalika Tiwari here. She says that my mother was suffering from COVID, was being treated here and was discharged here. Should she take the vaccine? Yes, she should take the vaccine because the vaccine will increase the immune response. Once a person gets infected by the COVID virus and gets treated, goes home, at that phase, after 1 month, the patient develops antibodies against this virus. But if you have other vaccines also, that will increase the immunogenic response more. That will increase the antibody level. There is no harm of taking the vaccines. It is for sure that this COVID vaccine will not give you COVID infection. COVID vaccine will not give you COVID infection. That need to be clear to every one of us, that COVID vaccine will not give you COVID infection.
Okay. Sir, another general query, I don't know what will be your response. Said that as the virus has spread so much that it is impossible to know who is infected actually. Then how we will come to know that we are also affected or not? Is there any signs or symptoms nowadays? You conclude. That means
Actually, what is that? The number one, it would be clinical symptoms. Now, the clinical symptoms will be, you'll be having fever, myalgia, headache, sore throat, because the virus itself replicates in the nasopharyngeal area. So, you will be having all these symptoms like a flu-like syndrome. Now, what happens? You have within 1 day or 2 days, you have this, and you come for the test. The COVID test comes out to be negative. Generally, after 3 to 5 days, generally after 5th day, 5 to 14 days, if they persist, then you should go for a test and get the COVID lab test, and then followed by the CT or CT chest or X-ray chest, which will give you features of that.
sir, thank you that you have answered all our general queries, and thank you so much overall, sir, that it's a wonderful information from you. Indeed, it's a very useful, I think, useful talk of you to us, to the teachers, to our dignitaries, and as well as for the students. Specifically, the students, they need to know the exact thing from a confirmed, reputed person that what is going on and what we should do from vaccination, because there are so many queries, so many rumors nowadays about the vaccination.
Thank you. Thank you, sir.
Thank you.
Thank you, sir, madam. Thank you.
Dr. Pal, I will request Professor Shukalpa De to please say a thank you note to Dr. Pal before the conclusion of the event.
Okay, thank you, Shohini. And good afternoon to honorable guest speaker, respected director, all the dignitaries and participants of today's national webinar on vaccination drive on COVID-19 pros and cons, which has been organized under the aegis of NSS division of Dr. B.C. Roy Engineering College, Durgapur. I am extremely privileged to accord my vote of thanks to our guest speaker, Dr. Partha Pal, Sir, Chief Medical Superintendent of the Mission Hospital, Durgapur, for his illuminating speech on this burning issue in today's contest. He has clarified many questions, those arising in common people's mind regarding government's vaccination initiative against COVID-19. Thank you, sir.
Thank you.
I would also like to thank our Honorable Director, Sir Dr. Piyush Palroy, for his enduring support and guidance in organizing this webinar of immense importance. Also, the organizing committee is thankful to our Register Madam, Mrs. Ruma Mitro, for her cooperation in every respect. I hereby thank Mr. Amitabh Ghosh and Shomodip Das for arranging online streaming of the whole program in YouTube. NSS coordinators Professor Sohini Ghosh and Professor Sunil Kumar Chaudhuri deserve special thanks for arranging and coordinating such an excellent webinar. I also thank Professor Priyanka Roy, co-coordinator of the program, and all other team members of NSS for their active involvement to make the webinar a grand success. I do hope all the student participants are benefited from the program. Thank you all, and once again, thank you everybody.
Okay, sir. Thank you, Dr. Pal. Now we can conclude the meeting. Okay, the students who are in this group, you may please leave now. The feedback form will be given to your respective email IDs. The mail IDs you have used for registration, you will get your feedback forms there. Okay. Everybody, please, you can start leaving the meeting now.